It's that time of year again, flu season. The Thunder Bay District Health Unit says it's started early and they've seen cases of the flu rise over the past 2 weeks. They're advising people to play it safe and get the flu shot. Dr. Janet DeMille is Thunder Bay's Medical Officer of Health. She's joining us this morning to tell us more. Good morning.
Good morning, Mary Jean.
So the health unit has warned of an increasing number of flu cases in the past 2 weeks. Can you give me a sense of how many cases you've been seeing?
So I think when we released that media on Tuesday, I think it was, we had, it was about 200 lab-confirmed cases of flu. And since that time, and I get a sort of a daily report, we're receiving anywhere from 10 to 30 additional cases every day. So I guess it's only been a couple of days, but this week. But so we are seeing, and a lot of them you could see on the trend, and I think we've now posted that trend on our dashboard on our website. It started with 1 or 2 cases a week, and then last week I think it was 100. So we're really seeing that, what looks like an exponential increase in those lab-confirmed flu cases in our area. And, those are just the people who are getting tested. And, of course, not everybody gets tested. Mm-hmm. So, that's just the tip of the iceberg for the total number of flu that might actually be happening in this area.
So you're able to test specifically for the flu?
So what's happening right now, and I know you guys have talked about it, obviously there's a big place that people get tested is at the emergency rooms, right? And they can actually, and seeing a lot of young folks and children going to the emerge, and there are swabs that are done that test for a variety of different respiratory viruses, and certainly flu is one of them. Of course, COVID is also a part of that as well. And so, it's really, they test for a variety, and we're certainly seeing, I don't have a lot of data for this region around all the others, but if there is in Ontario, there's certainly quite the mix of different viruses that are circulating, of which flu is one of them, and we've certainly seen in our area an increase in flu. Okay,
so these tests can kind of sort through a few things. It's not, a separate test for each thing?
It is like a test for multiple different viruses. And you know what? When we get we only receive reports of those that are reportable to public health, which is really just COVID and flu. But when we get those flu reports, we're actually seeing individuals that have more than one virus. So, and we've seen, unfortunately, people who've had COVID and flu at the same time. So that certainly is an added complication for right now.
Oh, dear.
Yeah.
And when does the flu season typically begin?
So it doesn't, it doesn't start on a particular date that are regular seasons do. But I think what we have generally seen is our flu season would start in November, usually by the end of November at some point. So we'll start getting those sporadic cases. Any time in November. We actually had a couple of sporadic cases in September, but it didn't really seem to go much until middle of October when those reports really started coming in. So we're maybe a month earlier than where we were, and of course what we're comparing to is the pre-pandemic times. Mm-hmm. So, I would say actually even 4 to 6 weeks earlier than what our average was prior to this.
So is this earlier start and the numbers you're seeing a concern for you?
Well, it absolutely is. And of course, we've talked about this before. We've got not only other respiratory viruses and RSV impacting our population, mostly children and youth at this time. We're now starting to see flu, and we continue to see a fair amount of COVID and have outbreaks related to COVID. So it's this sort of triple threat of these viruses, kind of circulating in our area. So that is of concern. What's particularly concerning about this early start to the flu season is that we've been rolling out flu vaccine And of course, earlier this week, it just opened up to the general population, 6 months of age and older. There was a lot of people who were eligible in October and who did come forward for their flu vaccine who were high risk, because that was what we were focusing on in October. But I'm concerned that there's a lot of high-risk people who really haven't come forward yet for their flu shot, and it takes a couple of weeks to get fully protected. So certainly that concerns me, that I really do want people at higher risk with flu to come forward now to get their flu shot, so that when it starts to spread, because these numbers are going to go up, it's going to go, right now it's largely in the younger population. It's going to spread throughout all ages. And of course, I'm particularly concerned of, people of older age who and those who are older but who have multiple other sort of health issues as well.
Now, you mentioned a lot of the testing that you're getting your information from right now is happening at the emergency room. How much more strain is this flu situation putting on the health system?
So, you'd have to ask them to sort of know, because I do appreciate that the acute care and, primary care have done a lot of work to really prepare, and Ontario Health and, has done a lot of work to be able to prepare. And I know they have a lot of processes in place so that they can ramp up and ramp down. So, but certainly, we are seeing a significant increase in emerge visits. That's here and in other places. And of course, people do require hospitalization at times. RSV, it's often the younger children. But with flu, and especially the H3N2, which is the strain of flu that's circulating, that often gets those who are older and those who may be younger but have underlying health issues. So that could put a significant strain. I certainly connect with the hospital here. I actually was chatting with them yesterday, but, and I can see that they're under a lot of pressure, and this is going to get worse before it gets better. So, that could significantly increase over the next couple of weeks.
Now, you've mentioned a few times now that a lot of the flu and RSV and so forth is hitting children. But right now, I've been hearing a lot of parents, and even this morning on World Report, trying to find medication, trying to keep their kids at home and treat fever, etc., but can't find medication. Any suggestions for them?
So I can appreciate how tough that is, right? And I received a picture from somebody of a store here that really had a lot of empty shelves around those products, and that's so key to helping children be comfortable when they've got an illnesses. And I think it's tough for parents. I know that there are some good information for parents around how to manage their children when they have colds and flus and stuff, and different things that they could do to sort of help them or as they navigate through that. But it is a difficult situation for sure.
And what do you know about this year's flu vaccine and how it's matching up with the strains? Yeah.
So sometimes early in the season, it's hard to know that information sort of comes out over time, right? And it's hard to know. But apparently, and I just heard this recently from the province, that there is evidence that this H3N2 strain of influenza A that's circulating, there's a good match. Appears to be a reasonable match with what's in the vaccine. The vaccine actually has different strains of the flu A and B, and so and this year there's also one that there's 4 strains in it. So the hope is that that collectively will be better. So I was reassured by hearing some of that. The initial sense is that there is a reasonable match, but we'll have more information down the road.
All right. Now, speaking of information, what do people need to know about when and where they can actually get flu shots?
So flu shots are fairly widely available. A very good channel is through pharmacies. There's a lot of pharmacies that are delivering flu shots, and if you need your COVID booster as well, many of them are doing that. Primary care is giving out a lot of flu shots. And I know some of them have done specific clinics, or you can call and make an appointment and they'll do clinics. And certainly here in Thunder Bay, and we also have clinics in the district where we call them COVID-19 vaccine clinics, but we will be offering anybody who comes in for their COVID vaccine, they can get their flu shot at the same time if they're 5 years in age and older. And then, as I heard you were announcing for us, thanks, that we're actually here at our clinic in Thunder Bay. We're sort of ramping up a bit because we really want to support people who are at high risk of flu, that they can actually just walk in to get their flu shot, even if they don't need a COVID shot. That's for people who are at higher risk. And we have opened up a clinic today and a clinic tomorrow to be able to support that.
Thank you once again for joining us to break things down, although on a different topic today. I appreciate it.
Okay. Thank you very much.
Bye-bye.
Bye-bye.
That was Dr. Janet DeMille, Thunder Bay's Medical Officer of Health.